Thank you, everybody, for coming to this hearing this morning. We have numerous members that are on their way, but we want to respect the time of our witnesses, and we appreciate them being with us today. But before I begin, I want to ask unanimous consent to allow our colleague and former committee member, Congressman McNerney of California, to sit at the dais and participate in today's hearing. Without objection, so ordered. So welcome to today's full committee hearing, an examination of bureaucratic barriers to care for our veterans. As we all know very well now, during a committee oversight hearing in early April, we came forward with the results of a committee investigation that had uncovered evidence suggesting that dozens of veterans died while waiting for care at the Phoenix Department of Veterans Health Care System. Just over 2 months later, we know now that in addition to 23 veteran deaths at the Department linked to delays in care earlier this spring, at least 35 more veterans died while awaiting care in the Phoenix area alone. What's more, a VA audit released earlier this week found that over 57,000 veterans have been waiting 90 days or more for their first VA medical appointment, and 64,000 veterans who have enrolled in the health care system over the last decade never received the appointment that they requested. That's 121,000 veterans who have been waiting for care to be provided that they earned. That number exceeds the population of several mid-sized U.S. cities like Athens, Georgia, Abilene, Texas, or Santa Clara, Texas, or even Evansville, Indiana. And I fear there's more yet to come. Yesterday I spoke to a group of VA providers from across the country at an event for the National Association of VA Physicians and Dentists. Speaking about the current crisis engulfing the Department, they've said that VA's procedures and processes are inconsistently applied, and often prevent efficient use of personnel. This statement echoes the serious calls for alarm that we've heard from others over recent weeks. During a recent committee hearing, Dr. Day, VA's Assistant Inspector General for VA's Health Care Inspection, testified that VA suffers from, and I quote, a lack of focus on health care delivery as priority one, unquote. As a result, quote, several organizational issues that impede the efficient and effective operation of the VA health care system and place patients at risk of unexpected outcomes, end quote. In an article published last week in the New England Journal of Medicine, a former VA Undersecretary for Health, Dr. Ken Kaiser, and a current staff physician at a major VA medical center wrote that the systemic data manipulation and lack of integrity VA experiences are but, quote, symptoms of a deeper pathology because, simply, VA has lost sight of its primary mission of providing timely access to consistently high-quality care, end quote. All of these remarks go to prove what we have already known. The VA health care system and the bureaucratic behemoth that accompanies it is complex, and its problems are even more complex. I believe that the majority of VA's workforce, in particular the doctors and nurses who provide our veterans with the care they need, do in fact endeavor to provide high-quality health care. Unfortunately, VA leadership has failed those employees almost as much as it has failed our veterans. And correcting those failures is going to take a lot more than the Band-Aid fixes the Department has proposed thus far. It's going to take wholesale, systematic reform of the entire Department, starting with holding senior staff accountable. VA hasn't gotten where it is today due to just bloated and ineffective middle management, or lack of training and professional development for administrative staff, or inefficient or non-existent productivity and staffing standards, or cumbersome and outdated IT infrastructure. The Department got where it is today due to a perfect storm of settling for the status quo. VA cannot continue business as usual. It's very clear the status quo is not acceptable, and it's time for real change. Again, beginning with accountability up to the highest levels of VA bureaucracy, and I hear repeatedly from the VA about its delivery of high-quality, patient-centered care. But this committee, Republicans and Democrats alike, will not rest until we hear that same assessment from every single veteran seeking care. It's time for VA to tell us the bad news, not just the good news. With that, I yield to our ranking member, Mr. Michaud, for any opening statement he might have.
Thank you very much, Mr. Chair, for having this very important hearing, examine the barriers to care for our veterans. This is a unique time in the history of the Department of Veterans Affairs. We as a committee have been responsible for bringing to light systematic problems by many dating back over a decade. But as we are shining the light on these problems, we must also begin to take steps to address them. I'm proud that this committee has addressed these problems in a bipartisan fashion, and I'm hopeful that this spirit continues as we roll up our sleeves and begin the hard work of finding solutions. The VHA is a sprawling organization with over 6 million unique patients, facilities spread all over the country, and nearly 275,000 employees and a $56 billion budget. To put VA, the largest integrated healthcare system in the country, in perspective, VHA is roughly the equivalent of 5 Mayo clinics combined. Recent admission of wrongdoing are shameful, and the practice will not be tolerated. The systematic lapse of integrity confirmed by the internal VHA Access Audit and the VA OIG report points to a bureaucracy that has seemed to lost its way in its focus. I think with these problems, the time is right to begin discussing how best to address these challenges, and the time might be now to effect big changes that will put the focus back on the veteran and away from the culture of complacency. In our discussion of reform, I want to make sure that we are not just rearranging the desk chairs. All the reorganization in the world will be futile without a strong base of values. I do not doubt the commitment of the vast majority of VA employees. However, sometimes we all know that we need to be reminded of who we are here to work for. We are here to work for the veteran, brave men and women who have sacrificed so much for our freedom, men and women who right now deserves better. I strongly suggest that VHA develop a code of conduct or a caregiver culture that will become ingrained throughout the organization, regardless of whether there is 1 visit or 50. Working in the VA requires an utmost integrity. As Dr. Rowe pointed out the other night, all VA employee needs to do, without a doubt, is they have to be reminded that they are working for the veteran, not a bureaucracy. As with most things, there are trade-offs when looking at structural reform: centralization versus decentralization, standardization versus innovation. These discussions have been ongoing for years, if not decades. I'd like to think VHA is an adaptable learning organization that can make needed transformation. But let me be clear, the only way we're going to truly address the litany of problems is to look at the fundamental change within the department. And rightfully, we're all looking at ways to address the problems as we see today. But I'm also hopeful that our ambitious schedule of hearings in the weeks ahead will think anew about how best to provide the quality, comprehensive care to our veterans in a timely fashion. And I hope that they challenge us to think anew about how to refashion systems and infrastructure, management and personal policy and procedures to address the access issues head-on and to help the VA live up to its ideal. I believe it is essential that we look at structural and cultural root causes that got us in this position in the first place. We have heard that the leadership of the medical centers feels disenfranchised. We have real concerns over the effective level of accountability. We need to shorten the feedback loop from the frontline provider to VHA leadership. One of the discussions we must have is over the right administrative structure of the VHA, how to ensure that policies and procedures are followed nationally while making sure that the VA is not a one-size-fits-all system. We have heard many times about the excessive, intrusive administrative burden our providers experience, which takes time away from caring for our veterans. We need to do what we can to eliminate this administrative work. Many are pointing to the IT infrastructure. There is no doubt that an outdated scheduling system contributes to the current problems and needs emergency upgrade. At the same time, we need more detail on what's happening to the millions of dollars Congress has appropriated for IT. Before we can look at investing even more money here, I want to know why the VA did not do a better job in planning strategically, anticipating the needs of facility system population, and putting in place actions, including things like IT upgrades to address these anticipated needs. The time is right to leverage outside expertise. There is no monopoly on good ideas. I look forward to hearing from the panels today and hope to continue this excellent discussion throughout the coming weeks. Once again, Mr. Chairman, I thank you very much and yield back.
Thank you very much to the ranking member. Joining us today, we actually have two panels. On our first panel, already seated at the table, is the Honorable Tim McLean, President of Humana Government Business, Mr. Dan Collard, Chief Operating Officer for the Studer Group, and Dr. Betty McCoy, Chairman for the Committee to Reduce Infection Deaths. We do appreciate all of you being here with us today. And with that, Mr. McLean, you are recognized for 5 minutes.
Thank you, Mr. Chairman. And Mr. Chairman, Ranking Member Michaud, and members of the committee, thank you for holding today's hearing on to examine bureaucratic barriers to health care for veterans. I will focus my remarks on the very complex subject of organizational impediments in the Veterans Health Administration that are not conducive to the delivery of good health care to veterans. In my written statement, which I ask be made a part of the record.
Without objection, all of your statements will be entered into the record.
I make 4 specific recommendations to improve organizational alignment in VHA. But in this oral statement, I want to address just one, and it's probably the one that is most disturbing to veterans in Congress, and that's a failure of ethics. There is a pervasive VA culture that puts personal gain and the system over the needs of the veteran, and this is wrong. And I want to make 2 points to the committee. Let's not have Congress and VA just put Band-Aids on the current crisis without resolving the systemic causes. And 2, I believe any long-term solution must include a culture and organizational assessment by a nationally recognized company. The current crisis differs from previous VA crises by the fact that it reflects a serious cultural deficit throughout VA at certain levels of management. This is anathema to the culture of what should be at VA. Now, I want to emphasize and make it clear that from my experience at VA, I found the vast majority of VA employees to be competent, professional, and dedicated to the primary mission of serving veterans. But the culture at certain management levels reflects an attitude of personal gain over service to veterans. Some major changes are required. But before making any major changes, I propose in my written statement that VA be directed to contract with a nationally recognized company to conduct a top-to-bottom assessment of the current culture. A gap analysis can then be performed to determine the current state and then what is needed to move the VA system to a veteran-centric 21st century system. The experience will be influenced by what I will call the voice of the veteran, which essentially is direct veteran input into what this culture should look like going forward. If Congress or VA fails to seize the once-in-a-generation opportunity to deliver a modern VA health care and benefits system, we will all be back in this hearing room in the future lamenting the then-current crisis. Mr. Chairman, this concludes my oral statement. I'd be glad to answer any questions. Thank you.
Thank you very much, sir. We appreciate your comments. Mr. Collard, you're recognized for 5 minutes.
Chairman Miller, Ranking Member Michaud, and committee members, thank you for this hearing as well. Thank you for the opportunity to address the committee on the issues of veterans.